Welcome to the storage room at Healthforce, Kentucky. We are showing the Promptflex birthing simulator from a company called Laerdal. This is used heavily in the UK to educate and train pre-licensure and post-licensure individuals on how to take care of birthing mothers. They have really moved the needle in maternal fetal mortality using this device. There's a lot of equipment, there's a lot of manuals that come with this, and we are willing to help train you and provide all the information that we know about it if you are wanting to use this for your pre-licensure students or also for your post-licensure students as well. We'll get into some of the applications and appliances. Healthforce Kentucky has 3 of these at the moment. There's a lot of things to show and kind of talk about, and I will admit I am not an obstetrics nurse, but I've played one before on TV, literally. So these are caput models, and as the baby is starting to crown or having difficult deliveries, these are different thicknesses. So if they have swelling, we're able to demonstrate some of these. They also go along with some of these modules that show where the fissures are, which help us determine placement and how the baby is descending. This is a manual puppeteer type of delivery module. And inside, I have it set up right now not to deliver a baby, but to have a measurement station to where practitioners can come in and find out how subjective or how accurate their measurements are. All of the different modules have how many centimeters and also how effaced the cervix is. And we can set these up to be different ones, or that we can just use them as outside measurement devices. Inside, we have the ability to adjust the amount of descent and also the position of where the head is lying. Obviously, you see we have a little baby butt here. We have a face, partial face. The fissures can be positioned anterior or posterior. The baby, if we were doing a manual delivery, has force sensors inside it. So if you're using forceps or suction, it will give us some feedback and information on how much force is being applied so that we are not applying too much. We do have our placenta with the umbilical cord. This cannot be cut, but you can put clamps on it and to the point of having a cut made. It does not have retained parts, but certainly you can talk about those. You can talk about McRoberts and leg positioning. We also have one of the models has full set of legs that will help with that positioning for McRoberts or for shoulder dystocia. Also, there is a rigid pubic bone here that they can provide downward pressure for those shoulder dystocia scenarios. We can also bleed from the outside and have postpartum hemorrhage. Fundal massage is one of those things that you can also work on with placement, but we have a wide variety of different types of presentations, dilations, and also other modules that can come along with it. So this is Healthforce, Kentucky with the Promptflex birthing simulator. If you are within our 16 county region and interested in leasing or having a loan of any of the equipment, please contact healthforcekentucky.org and fill out an event, equipment, or tour request, and one of our staff members will be back with you as soon as we can.